students. Today we are going to see the autotoxicity. What do you understand by autotoxicity? Yes, autotoxicity means it is a damage to the ear because of the toxic substance. Means what? Drug. So let's see what is autotoxicity. Autotoxicity is a damage caused by the toxic effect of certain drugs, either cochlear or the vestibular, both parts of the body. It can cause because of any drug, like it can affect the cochlear part or the vestibular or the both areas. So autotoxic drugs are those that have a potential cause of toxic reaction in inner ear. Because of certain medication, it will affect on the ear, internal ear, and it can cause a toxic reaction in the inner ear and structure, inner ear structure such as the cochlear, vestibular and the semicircular canals. So what will be the causes for, what will be the symptoms we can see, or what will be the problems we can see? That is hearing loss, tinnitus, some sound. Okay, the sound will come into the ear. There will be disequilibrium. The person will not able to walk properly. The dizziness can result from the drug-induced damage to this auditory canal, and the balance system will get difficult. So basically, we can understand the autotoxicity means the drug. Some drugs will cause the reaction, toxic reaction to the vestibular and the cochlear region, and that can we can call them as a autotoxicity. So autotoxicity drugs are like aminoglycoside, antibiotics. Certain medications are there, that is the aminoglycosides we can see. Cochleotoxic like neomycin, keramycin, tramicillin, tombracin. These are the some medications which will affect on the cochlear region. That is called as cochleotoxic medication. Vestibular toxic, that is streptomycin and gentamicin. These drugs will affect on the vestibular region. The diuretics, certain diuretics are there which will affect on the which will cause the autotoxicity, that is the furosemide and the furosemide salicylate. Toxic agents like mustard seeds and the platinum. These are also some agents which also cause the autotoxicity. Then antiprotozoal quinine. Okay, which quinine is used for the person who is having the malaria. Antileptic drugs and phenytoin sodium. Antihypertensive agents like antihypertensive agents also can cause the person autotoxicity. Beta blockers. These are the drugs which causes the autotoxicity. Next one is the routes of access parenterally. Usually the routes can be given the parenteral route and the oral routes. Sometimes topical we can give the ear routes or the buds. According to this route of access we can give the medications or the drugs for the treatment. Now next we will see what are the toxicity clinical features like high pitched tinnitus. The person will have the sound in the ear that will be high pitched. Sensory neural deafness for high frequency. The sensory, when we call sensory neural deafness, when the internal ear getting affected. So vertigo will be there. Vestibular toxic drugs with the vestibular toxic drug. What is vertigo? Vertigo in that person will have the feeling that the person is having feeling drowsiness, or the person will feel fainting, or the person will feel that he is moving around. Everything is moving around. The treatment, usually the treatment given for sudden sensory neural deafness can be advised as steroids. In case of sudden deafness, if the person is having sudden deafness because of the drugs, then the steroids can be given. Vasodilators increase the blood flow of liquid, that can be given vasodilators. Vitamin D, all types of vitamin B, B12, carbogen, to improve the blood circulation in the cochlear region, it can be given. Withdrawal of autotoxic drugs may prevent further damage in the hearing. Okay, sometimes whatever the drug is causing the autotoxicity, it is very important to inhale that drug. Next is hearing aids can be provided if it is permanent hearing loss. Cochlear implants in patients with profound bilateral sensory neural deafness. If the person is having profound deafness, the person is not able to hear, then according to the audiometric test and according to the other impedance test, we can give the cochlear implants to the person. Now we are going to see about the acute tonsillitis. What is tonsillitis? Inflammation in the tonsils. It is very common in the children. So acute tonsillitis is one of the most common infection encountered in early days practice. Like up to 15 years of age, we can see the person is suffering from the tonsillitis. It can be affected to both sexes, most often caused by viruses and bacterial infection. You can see the how the tonsillitis is there and the person is having rhinitis. The most common bacterium is Streptococcus pyogenes. Predisposing factors we can see endogenous, like pre-existing chronic tonsillitis if the person is having for a longer duration the tonsillitis. The post-nasal discharge due to sinusitis if the person is having continuous discharge. Residual tonsillar issues after tonsillectomy. If some tissues of tonsils is remaining, that can also lead to the infection. General lowering of the resistance. If any person has lowered the resistance of the immunity, that person can also get tonsillitis. Exanthema prenata, inferior disease characterized by rashes. If any person is having the rashes all over the body or the lymphoma, that person there is chances that get the tonsillitis. Blood hysteresis, very low resistance due to alveolar cytosis like leukemia. If the person is having any kind of cancer, that also can lead to the symptom of tonsillitis. So what are the exogenous factors? We can see ingestion of cold drinks or cold food may directly cause the infection or to lower the resistance of vasoconstriction. That also can lead to the inflammation and the redness of the tonsils. Congestion, like causing contagion, like infection contacted from other individual having infection. When we are drinking the water with the same glass or same bottle, or we are having the direct contact with the person, infected person, that also can lead to the infection. Pollution and crowded, ill-ventilated environment. If the pollution is very high, the people who are living in the crowded area, that can also lead to the